Good afternoon all, and welcome to our webinar entitled Deliver a First-Rate Healthcare and Childcare Technical Qualification Offer. Technical Advisor breaks it down, and thank you for joining us today. Before I introduce our main speaker, I'd like to explain a few things about our webinar platform to really allow you to get the most out of this experience. So all viewers, you will be in listen-only mode. If you want to engage with the webinar, please use the on-screen panel. So on the panel to your right, you can adjust your audio settings and use the question tab to engage with us. Please note that the chat section on the panel is deactivated, so do not use the question tab. So please use the question tab. During our webinar, we will be running a number of polls. To record your responses, please click on the on-screen voting button when asked to do so. And after the webinar, we will be providing a recording of the webinar, a copy of all slides, and a fact sheet to address any unanswered questions. Now I would like to turn it over to our main presenter, Paul Robottom, Healthcare and Childcare Technical Advisor at City & Guilds.
Good afternoon, everybody. Welcome to the webinar. My name is Paul Robottom. I'm one of the National Advisors at City & Guilds for Healthcare and Childcare. And this afternoon we're going to take you through the City & Guilds offer, technical offer, for our new Key Stage 5 Level 2 and Level 3 qualifications. The content of the webinar will cover everything to do with the units, the assessment strategy, and the resources available to support delivery within your own establishment. So without further ado, I'm going to take you into the first video clippage to just set the scene really in relation to the City & Guilds offer. And you should see up on the screen a slide which gives you the background to the change and reforms. This lasts about 2 minutes.
Following the Alison-Wolf report in 2011, the need to overhaul vocational education. It started at Key Stage 4, 14 to 16-year-olds, and identified that the qualifications needed to stand up to the rigour and quality of the GCSE to ensure that vocational education came across in the same respect as the GCSE. These new qualifications are 120 guided learning hours in size, they have rigour and quality, and they also have breadth and depth of subject area, so it doesn't narrow that young person into their choices at post-16. These qualifications at Key Stage 4 also include synoptic assessment and external end assessment. At Key Stage 5, so post-16 qualifications, we have different categories. At Level 2, we will have qualifications that are going to be called technical certificates. These qualifications will be 150 guided learning hours as a minimum, although at City & Guilds we expect our qualifications to be much bigger than that. These qualifications need to actually equip a learner to move forward, progress into further education, onto an apprenticeship, or onto a Level 3 tech level, or even into employment. These qualifications have to have rigour and quality, but the assessment will be quite key. So the qualifications need to have that full breadth and depth that actually lead to a specific job role. At Key Stage 5 Level 3, we're going to have technical level qualifications. These qualifications are around 300 guided learning hours, although we suspect at City & Guilds we will have much larger qualifications. These qualifications will have the same status as an A-level and actually will allow that learner to move into the world of work, through an apprenticeship, onto a specific job role, or even into higher education. These tech level qualifications will have synoptic and end assessment. So at Key Stage 5, our technical certificates and our technical level qualifications have also got employer involvement. As part of the rules for the Department of Education, employers need to be involved in the design and the development of these qualifications. And here at City & Guilds, we're really embracing that chance. So for all of these new style qualifications, the Department of Education have set clear design features in regard to the size of the qualification, endorsements and support needed from employers, professional associations or universities. And the assessment needs to include synopticity and externality. But most importantly, there will only be one chance for a resit opportunity. This actually coincides with the principles of GCSEs and A-levels. To guide you through these new measures, we offer lots of different support, from events, one-to-one advice, and to find out more, please speak to your business manager.
Okay, to start off with, I'm going to take you through the new City and Guilds Key Stage 5 Level 2 Certificate in Healthcare, Care and Childcare. Just to remind people listening today, you will get a copy of the PowerPoint that we're presenting for you, and at the end of the webinar we'll be giving you guidance on the resources and people to contact should you require further information. So the first qualification, as I said, is the Level 2 Key Stage 5 Certificate in Healthcare, Care and Childcare. Okay, now the design principles for this qualification, in line with the DFE requirements, have meant that with our employers in health, care and childcare, City and Guilds has available to you a new Level 2 certificate, which is 360 guided learning hours. And I'll be talking you through the units within that qualification a bit later on, and they can be made up of 30 and 60 and 90 GLH hours per unit. There are no UCAS points attached to this qualification, and there is a mandatory content, and by that I mean there are no optional units and no pathways within this qualification. One of the things that the employers that we worked with were very keen on was to ensure that a 16-year-old undertaking this qualification on a full-time basis would be exposed to the world of health, care and childcare. So what this qualification does is give them ample opportunity to experience those sector areas and get a flavour of the possibilities in terms of career progression and apprenticeships available within those career sector areas. So in terms of the specific qualification, you'll see now on the screen the plan number, the City and Guilds qualification number, and it is available for delivery from September 2017. And you'll see there the link on the City and Guilds website to the qualification handbook, which I would recommend that you download and have a look at the requirements in terms of all the units and an outline of the qualification assessment strategy. You'll see under the link to the handbook the employers that we approached who've seen the qualification, and they've given letters of endorsement to us for the DFE, and they like the qualification, and it meets obviously the training development needs, the skills, the knowledge and behaviours that they'd be looking for the students who would be completing this particular qualification. So in terms of the specifics, it is a full Level 2 qualification. It's 360 guided learning hours, and there are 9 mandatory units, which you'll see in a minute. It's delivered over 1 academic year, and there is a work practice placement requirement of between 120 and 150 hours for each student for that particular year. In other words, they have to achieve those hours as part of the qualification requirement. So as I said earlier, the qualification is recognised by employers, it's been designed and endorsed by employers, and clearly creates a clear pathway to work and on to apprenticeship programs, either in health, care or childcare. It does equip the learners with that specialist knowledge and skills, enabling them to consider entering careers in those 3 sector areas. So in terms of the units themselves, as I said, there are 9 mandatory units, and you'll see them up on the screen. The largest size unit is obviously the first one, working in healthcare and care, which is 90 guided learning hours, followed by another unit working with babies, children, young people and families in care and education. And then the remaining units cover the values, beliefs and behaviours of working in those sectors, effective communication, safeguarding, health and safety. And one of the units that's created immense interest from the centres we're working with at the moment is Unit 9, which is looking at developing resilience for working in health, care and childcare. And that covers everything that would probably be the not so nice things going into these sector areas, and is very specific in terms of the types of things that people have to work with, have to deal with, and how you manage that in relation to the stresses that those areas, those care professional areas actually can present when moving into that sector area. So in terms of the work practice, there is, you probably see here, an increase in the work placement hours, possibly from other qualifications that you offer. And the employers that we worked with wanted to see an increase in work practice hours. So for this qualification, all students will be required as part of the qualification requirement to achieve a minimum of 120 to 150 work placement hours. Now, in terms of how this can be made up, you'll see the 3 bullet points there. So they can complete that hourly requirement, those hourly requirements, by either work practice set up by you as the training provider and managed by you as the training provider. And secondly, they could consider doing voluntary work in healthcare and or childcare practice, or included within the requirement, some students will be able to get paid employment in healthcare and or childcare. So in essence, there's 3 ways in which the students can achieve those work placement hours. So basically the onus of responsibility isn't solely resting with you as the training provider. Further details of that are available in our qualification handbook. Now you'll see up on the screen you'll see a work placement workbook, okay, and this comes already for you to download for all your students. That is the front cover, but basically this will be completed online or paper-based by the students as they move through their work placements managed by you as the training provider. And the workbook itself allows students to reflect on their practice and basically align the skills that they're developing within their practice, either in health, childcare or care, back into the teaching and learning that you've been providing them as part of their classroom studies. Students, in essence, we don't specify the number of placements these students need to undertake. We leave that with you as the training provider, working with the needs of your students. So basically, a student could be in a placement, the same placement, for the whole duration of the qualification. So that might be a placement in health, that could be a placement in care, or it could be a placement within a childcare setting. Should the student wish to actually undertake more than one placement, that's quite in their rights, so they could well do a placement in health, care and childcare during the year, but again, we don't stipulate any mandatory requirements with regard to that, and we leave that for you and your students to discuss further when they come onto the programme. Now, in terms of the assessment for this qualification, okay, there is a new assessment strategy that City and Guilds has adopted with its technicals, okay, and in terms of the time frame, we can give an example now, the exemplar summative assessment for the level 2 certificate. And you should see on the screen that for this qualification, the knowledge test is 40% of the overall weighting for the grade for this qualification. So basically, we set externally a knowledge test, which is externally marked, and that will be delivered to you either online or paper-based. The second part of the summative assessment requirement for the level 2 is a synoptic assignment. So what you do formatively leading up to these 2 types of assessment, we leave that to you in terms of how you're working with your students, but City and Guilds requirement to achieve the qual carries the knowledge and the synoptic. Now, with regard to the synoptic assessment, that is 60% weighting to the overall grade. Students have to pass the test and the synoptic, and the exemplar test and synoptic is available on our qualification website, which was the link I showed you earlier. Now, in terms of the exemplar, you will see that for the synoptic, the students have to undertake a case study scenario, which basically the exemplar will show this is around activity planning and healthy living. The second is a skills task, and this very much relates to Unit 203 of the qualification, where they will have to demonstrate skills that they've learned as part of their practice, as part of the unit itself, and will require them to demonstrate one of the following. And I'll give you some examples of this, which is covered within the unit. It could be that they have to demonstrate their ability in bed bathing an adult, washing hair, changing a nappy, bottle feeding, basic principles of moving and handling, or bathing a baby. And one of those skills tests will be selected as part of the synoptic summative requirement. And finally, they will have to do an interview, and this is undertaken at 15 minutes in length, will be recorded, and basically an assessor, a tutor, and or an employer, if that's something that the centre wish to involve within the programme, can take the learner through. So this interview is very much a Q&A. There's clear guidance on that interview, and it will really allow the students to demonstrate their knowledge and understanding of their practice in relation to good care practice, and they'll have a chance to really sell themselves in terms of the skills that they've learned through their work practice. So in terms of the assessment dates, there are no unit summative assignments in this qualification. So the students will not be required to undertake unit-by-unit summative assignments that are marked by lecturers who are delivering or tutors delivering this qualification. And in terms of the key assessment dates this year, sorry, to give an example, sorry, in September 17, 18, the basic principles are that if you're registering learners on this program, you register them in September, and the live synoptic assignment, which I referred to earlier, is released to you as centres on the 4th of September, so very early on in the academic year. You don't have optional units as part of this qualification, but you will be expected to ensure your learners are all registered on the qualification by the 3rd of November. And then after that, you then book your learners on to the exam series, in other words, that externally set exam, which I referred to earlier, and onto the synoptic assessment. All right, and the deadline for those, for the exam and the synoptics, is up on the screen that you can see in front of you. In terms of key assessment dates next year, so obviously your students would start in September and they go through the academic year, and you'll see on the screen there the dates, the key assessment dates for the synoptic and the exam series. So you'll see there that even though the live synoptic was released to you in September, it doesn't go to your students until February. Okay, it goes out to your students in February. They have their first exam in February/March, and the exact date for this qualification will be released to you in September. And then after the exam, if they don't achieve the grade that they required as part of the exam, they will have a resit opportunity, as you'll see further down on that screen, second exam series for resits in May and June of that academic year. There is no resubmission for the synoptic assessment, but those dates in front of you are self-explanatory. And as I said, when we talk more about the further support you get after today, we will go through that with you in far more detail. Okay, so partly one of the things you may want to go away and think about today, if you're considering delivering this qualification in September, is to download the qualification handbook, the link I gave to you in a previous slide. You can download the exemplar test paper, and you can download the exemplar synoptic requirement. So these are good guides for you in relation to the current assessment mechanisms for the program, and give you a feel and a flavour of what the students will have to do in their live assessments in 2017-18. Some centres may want to use those exemplar as mock exams and mock tests and mock synoptics before they actually go, the live ones are actually launched to your students. So without further ado, we are now going to give you a poll question on the basis of what I've been covering so far. Please rest assured that after today, if you want further information, as I said, we will contact you further and go into this in much more detail, but this will give you the overview. So the first poll question is coming up.
Okay, so if you can just click on your screen, you'll see the question, how interested are you in delivering the new Level 2 Technical Qualification in Healthcare, Care, and Childcare from September 2017? So if you can just click that, and then we will bring you back to fantastic. We have most polls back in. Okay, and it looks like 67% are very interested in delivering the Level 2s from September 2017. Okay, fantastic. We'll carry on.
Okay, before we move on, I just want to touch base with everybody. Some of you might be sitting there thinking or listening, thinking, well, why haven't they got a specific qualification for health? specific qualification for care and a specific qualification for those students who perhaps wanted to work in early years or childcare. We consulted widely with employers and colleges in relation to this new bill, this new qualification, and the general consensus was that actually a combined qualification would be best suited for those students perhaps who were unsure about which area of work they wanted to go into, and that we wanted them to be exposed to the whole world of healthcare and childcare, so really give them a very good grounding about all the career opportunities in all sector areas, which is why the qualification in its own right covers the areas that it does. So, you know, one of the employers quite rightly said, yeah, when the 16-year-old opens their front door, we want to make sure they are exposed to all those sectors to enable them to make a really good informed choice about where they would like to progress, either directly into employment in one of those sector areas, or onto an apprenticeship program, or progress further onto our Key Stage 5 Level 3 technical diplomas in health and care, which is something I'm going to talk about now. So the new Key Stage 5 Level 3 technical diplomas, you'll see the slide up on the screen. Okay, this qualification, again, in relation to the DFE design principles, Sitting Guilds chose, working with its employers, and I'll illustrate this in just a moment. We have two qualifications. We have a 540 qualification and we have a 1080 GLH qualification. Each year of the qualifications has UCAS points, and I'll explain what those points are in a minute. Okay, and again, there is mandatory content, and it's not until the second year of the qualification do you get pathways. In other words, we have two pathways in year 2 in health, one in health and one in care. So in terms of the Key Stage 5, Sitting Guilds doesn't stipulate entry requirements, but for colleges delivering this qualification now, it would appear that the majority are setting 5 GCSEs, grades C and above, including English and Maths, as entry requirements, and for those students considering entering nursing as a career, they are looking for science at GCSE grade C or above. And I think my advice to all of you would be, where you have students looking to progress onto higher education or further professional training, please work backwards to ensure that you know and they know what their entry requirements are for those universities or further professional training, to enable that student to set their targets, to set their achievement levels, and know clearly from the start what they have to do to achieve. So up on the screen, you will now see that several occasions I'm asked by centres what's the difference between applied general qualifications and technical level qualifications. Well, we have available, as this webinar is about, our technical level qualifications, and up on the screen you'll see the difference between the two. Our technical qualifications at Key Stage 5 Level 3 are equivalent to 3 A-levels, on par with A-levels, recognised by employers, designed with employers, creating clear pathways and destination points. So when I talk through the two qualifications in a minute, the first year qualification, the 540 technical diploma, is very much built to allow those learners who achieve it to progress onto apprenticeship programs or directly into employment in health or care. Those students progressing into year 2 of the qualification are obviously considering an additional exit point, which I mentioned earlier would probably be higher education or further professional training in higher education, but it doesn't stop them applying then for going on to an apprenticeship program or directly into employment. And as I said earlier, UCAS points are applied attached to both years of the qualification. So what are these qualifications? Well, here they are up on the screen. So we have available since last September 16, and these qualifications are being delivered now by colleges across England, and I'll show you who they are in a moment. We have a Level 3 Advanced Technical Diploma in Health and Care. It's 540, okay, GLH, and has that stepping off point after year 1. So what that means is that you can register your learners on the Level 3, and then the students can leave after the year having achieved the Advanced Technical Diploma. And students leaving that qualification at that stage, I guess, would probably be going directly into employment or progressing into an apprenticeship program. For those students not wanting to leave, and that one qualification is graded in its own right, okay, and carries UCAS points. For those students not wanting to leave, they will progress into year 2, and they will then work to achieve the level 3 advanced technical extended diploma in health and care. Now below there you will see the link to the qualification handbooks for both those qualifications. Okay, so by all means after today, click on the link when you receive the PowerPoint, and that will then take you through to the information and all the units. In terms of the design of this qualification, or these 2 qualifications, you'll see on the screen there the employers that Sitting Guilds worked with, and the employers very much provided the support, guidance, commentary, feedback on the units within it. There was clear steer from the employers that they didn't want optional units, or hardly any optional units in this qualification. So when we look at the structure in a minute, you'll see quite clearly that there are mandatory units, and that's it until you get into year 2. And you'll see there the universities that I worked with directly in the qualification build, who provided excellent feedback and support and guidance on the units, the content of the units, and gave us the support that we needed pre-DFE approval. And just to, again, remind people who are listening today, this qualification is being delivered already, and it was started being delivered last September 16. And there are colleges, obviously, whose students are working now through the synoptic requirements of the qualifications, and in actual fact, have their exam later this week. So in terms of the HEI support, we've obviously gone out and received recognition and agreement from universities across England who will consider the Key Stage 5 Level 3 Technical Extended Diploma against qualifications, degree programs of further professional training that they offer. And these HEIs include, and there's a list as you'll see on the screen. Some of you calling in today may well be very close to those universities, but it will give you a flavour of those universities who will look at your students with their respective entry grades into further training. And please be mindful that not all universities set the same entry requirements, so it's very important to make sure your students know what those entry requirements are. And on the second slide, again, you'll see additional universities listed there. And again, as it said at the bottom there, subject to entry grades, any university who's previously accepted a BTEC in health and social care, not health science, currently 90% of our HEs that we've approached will consider the Advanced Technical Extended Diploma in Health and Care as the equivalent, which is really good news. So in terms of colleges already delivering the Key Stage 5 Level 3 Diploma, you'll see on the left-hand side there are 5 colleges listed there who started delivering this in September last year. And already you'll see on the right-hand side those colleges who have either got approval already for the new Level 2 certificate and the Level 3 diploma, or are awaiting approval with us over the coming weeks, stroke months. But they all intend to start delivering in September 2017, which is really good news. So in terms of looking at the actual units, now this is the year 1. So this is the first year, the Level 3 Advanced Technical Diploma in Health and Care. It's 540 GLH, okay, and as you'll see on the screen, there are 9 mandatory units. There are no optional units. All these units are mandatory, and they are all the same size. They are all 60 GLH, okay, and you'll see at the very bottom there that the employers, again, you'll see an increase. The employers wanted an increase in work practice. So you'll see that for every student completing this qualification or registered for this qualification, there will be a requirement that they have to do a minimum of 200 to 370 hours per year work practice requirements in health or care, sorry. And again, similar to the Level 2, there are no requirements. We don't stipulate any requirements in terms of those placements, other than they have to meet those hours as part of the qualification requirements. So, for example, a student could spend the whole year working, as an example, in a residential care home. They could spend the whole year, subject to approval by your local NHS trust, for example, on a ward, a clinical ward. So they're really building their work practice to support their career intentions. So Having successfully achieved year 1, as I said earlier, some students may choose to leave, but others will progress. They want to go into year 2. And this is year 2. And again, they all have, irrespective of their career intentions, so whether they want to go into a health career or a care career, they will all have to achieve the 7 mandatory units. So you'll see on the left-hand side, Unit 310 to Year 316. Those are mandatory. And then for those students wanting to pursue careers in nursing, midwifery, they would be expected to go onto the health pathway, where there will be an additional 2 mandatory units. But if they wanted a care pathway, and those perhaps students who perhaps wanted either to go in and study, I don't know, sociology, or consider looking at a career in social work, they probably would want to take the care pathway. But obviously we leave that with you to talk through this with your students who are progressing on to year 2. But there are no additional optional units. All right, so there are 2 pathways in year 2, and they cannot alternate units between the health and care pathway. So that basically means that if you're choosing a health pathway, you have to do Unit 317 and 318. And if you're doing a care pathway, you will have to do Unit 319 and 320. And again, in year 2, there's the additional requirement that all your students will have to do an additional 200 to 370 hours work practice for the 2nd year of this program. And again, we leave that to you as the training provider to manage. So in terms of that work placement requirement, okay, you'll see on the left-hand side exactly the same as the Level 2 certificate. The students can meet that requirement by the end of the academic year, either through work experience placements managed by yourselves in terms of the training provider, either, or in addition to that, voluntary work that they may find themselves in health or care, or thirdly, paid employment in healthcare and or childcare practice. But please be mindful that this is not a childcare Level 3 diploma. We have an alternative qualification, which I'll talk about later on, to meet the needs of those learners at that level who want to go into specifically into early years. But it may well be that some students, hypothetically in year 2 of this program, may well want to go into paediatric nursing. So obviously they may want to do a childcare practice placement in year 2, right? Which is why we have this included. But this will be explained further to you after today in the event you need further support. So to support work placement practice, up on the screen, you'll see that all year 1 students will have to complete a work placement workbook, all right? And it's very much involves them in undertaking reflective practice linked to care behaviours, care skills, care knowledge, and they have to complete 6 reflective logs in year 1. Now the workbook itself is not marked, in other words, it doesn't form part of the summative grading. However, they will need to take that into their summative synoptic requirement, which I'll explain what that means later on, but it will necessitate that they have to participate in a recorded minimum 30 minutes professional discussion. And into that they can take their, and we encourage them to take in their reflective workbook and use that as evidence to demonstrate how they've aligned their knowledge and skills together within their work practice. In year 2, they have a 2nd work placement practice book, which follows similarly to year 1, okay, and extends the skills of reflection. And again, this is utilised or used in part in the synoptic assessment for year 2. So it's very much an opportunity for them to demonstrate their skills of practice when they're out on these work practice placements. So I mentioned earlier about UCAS. So the qualification has UCAS points attached to them. I think this is old currency. Okay, I've got the new currency in a moment, but this is for those of you who are familiar with the UCAS point system. The certificate and diploma, so the Level 2 certificate we mentioned earlier and the Level 3 diplomas, Key Stage 5 Level 3, are graded distinction star, distinction, merit, or pass. And that grade is determined by the successful completion of the external testing and the synoptic requirement. Okay, so for this qualification, obviously UCAS points are attached to the 1st year of the qualification and the 1080 extended technical diploma with a distinction grade, as you'll see there, carries 420 UCAS points. In the new currency, okay, you'll see there that the point system below on the lower level, okay, right-hand side for 1080 qualification, points for UCAS points attached to a distinction star is 168, and obviously for a 540 you would halve those, the 168, the 144, the 96 and the 48 for the 540. So in terms of a poll question, which I think is now coming, based on what you've heard so far, we're going to ask you another further question.
So this poll question is, how many of your students are interested in nurse training? I'll leave it up for about 30 seconds. And results coming in. Okay, I'll leave it up for another 10 seconds just so we can hopefully get a few more responses in.
Okay, so it would seem that, yes, obviously a lot of your students could well be considering nurse training or even midwifery training in the future, but that may not necessarily be for all, which is why in year 2 we have that care pathway that those who don't want to pursue those careers can have alternative choices. So back to the PowerPoint. In terms of the assessment for the level 3 qualifications, okay, I'll take you through the assessment requirements, which are the same as level 2. So in terms of what the current students are doing, who are doing the qualification this year, so we have a knowledge test. So all students will be undertaken as part of the summative assessment requirement a knowledge test externally set by City and Guilds, externally marked by City and Guilds, and that would be online or paper-based. And then that would be 40% of the overall grade. And then they have an additional synoptic assessment, summative assessment to undertake, which, as I said to you earlier, would be released to you in September, so at the start of the academic year, but would not go out to the students until later on in the academic year. And this year's synoptic consists of 3 case studies, which are undertaken under controlled conditions, which is externally set, internally marked by US centres and externally moderated by City and Guilds. And in addition, the final part of the synoptic would be that all students would have to undertake a professional discussion. Okay, and the professional discussion lasts a minimum of 30 minutes, and it is led by the student. And it would cover 11 areas. So this is very much now a jump, as you'll see, from the level 2 interview, which I mentioned earlier, up to the level 3 professional discussion. Okay, so you'll see the step jump there into students then leading that professional discussion. And in terms of marking, you would mark the synoptic as 1. So this year you have the 3 case studies and professional discussion, which is marked as 1, and that is internally marked, but as I said, externally moderated by City and Guilds. For those students moving on to the year 2, so that's the extended technical diploma, okay, the advanced technical diploma, there is again a knowledge test for year 2, okay, and the test is very much based on the pathway that your students have chosen to take. So in other words, the external test, which is externally set and externally marked by City and Guilds, there is a health test and there is a care test. All right, so it's very much designed to test the knowledge and skills that those students have learned on those particular 2 pathways. And in addition to that, there is 2 mini projects which forms part of the synoptic, and again you would know what those were because they would be launched to you in September. So I'm not going to go through a repeat of what I covered earlier, but this is just to revisit the key assessment dates for 2017-18. So those of you wanting to deliver this qualification from this September, All right, the dates are clearly the same as the level 2. All right, so I think they're pretty much self-explanatory. But again, when we follow you up after today, we as advisors will take you through this in much more detail. But I would stress it'd be useful if you go onto our qualification website for these qualifications, that you will be able to download the exemplar test for year 1 and the exemplar synoptics. So it will give you a very good feel of what the students have had to do this year, including that professional discussion, okay, which covers the 11 themes that you'll see in the exemplar. So we now have another poll question for you, and that will be as follows.
So the poll question is, how interested are you in delivering the new Level 3 Technical Qualification in Health and Care from September 2017? Options are on there. If you can please select one. Okay, votes are coming in. Thank you for participating. I'll leave it open for another few seconds, and then we'll look at results.
Okay, so yeah, it looks a lot of you are interested in this new qualification. I think one of the things you're probably recognizing already is a very different assessment approach has been adopted through our technical assessment strategy. Okay, it's very different possibly to what you're used to in the past. And what I would say is that centres, as you'll see, the number of quotes that we've been showing up on the screen for one of our colleges at the moment, the feedback has been extremely positive. And like the Level 2 certificate, the units that I've covered for the year 1 of the qualification and year 2, there are no unit assignments. Okay, so there are no unit summative assignments. The assessment strategy for the technicals is, as I've shown, a synoptic assessment managed by yourselves, okay, externally set, internally marked and externally moderated, and the external test, which is externally set and externally marked by City and Guilds. So we're on the homeward stretch now, just to start looking at the assessment objectives. So in terms of the synoptic, okay, the synoptics, as I said, are marked by you, all right, and they will be marked under the 5 assessment objectives up on the screen now. So you are assessing, for example, students' recall of knowledge, attention to detail, bringing everything together. Obviously, those objectives are broken down in much more detail, and we would go through those with you if you needed further information about, but that will give you an overview of how you are grading, how marking the synoptic work. So, on top of technical advisors, myself and other colleagues, we do have a national moderation support team. So this is a team based up in our Wakefield office, sitting as in Wakefield, who will be there to support you. And the areas that they will support you with are on the left-hand side at the bottom. So they'll talk you through the moderation process, how to get approval with City and Guilds to run these qualifications, the timescales, etc., etc. Okay. And in terms of further assessment information, I'm not going to go through all these with you, but you'll see up on the screen really an overview of the qualifications, the technical qualifications as a whole, and what's different in relation to this new offer, which again, many of you already are considering launching for September. So in terms of our final poll question for you, it's coming up on the screen now.
So one of our final ones is, from what you've heard so far, are you in support of our new assessment approach? %36% have voted, so I'll leave it open just for another few moments. Looking like the majority are feeling positive. I'll keep it open.
Yeah, thank you, folks. Yes, it looks, yeah, 71% yes, very positive. Others wanting more information, yes, that's fair enough. And when I go through what happens after today, because the plan is that if you are interested, we would come out to visit you directly on site and talk to your curriculum teams in much more detail. And yes, we would go through the assessment approach in much more detail than we have done today. But yes, so far with those colleges delivering this, it's gone down exceptionally well. They like it, the students like it, which is more important than anything else, and it really does bring in that holistic assessment throughout the whole year or the whole 2 years, depending on which qualification you're doing. So yeah, we will take you through that in much more depth, rest assured. So finally, some information there about funding. I think that's pretty straightforward, really. I won't go through all the details here, but it will give you funding guidance in terms of how these qualifications are funded. So please read that at your leisure once you receive this PowerPoint. And in terms of additional support, okay, again, what happens after today? That's the first thing. Well, you'll see my contact details available for you to contact me directly. And what basically happens is that we would arrange a date to come and visit your centre, a mutually convenient date, where we would expect to see the heads of department, curriculum managers, curriculum teams who are considering delivering this new qualification or these new qualifications in September this year. And we would talk through the qualification approval process and really put the meat on the bones in relation to the units, more detail about the assessment strategy and the support you're going to get from City and Guilds when you start delivering. And I think that's a really important point, that taking on board a new qualification, okay, is very exciting, but also you need that support around you to make sure that yes, it does run seamlessly and that you progress through the first academic year feeling as though yep, you're well supported and have all your queries and questions answered. So there's going to be a lot of support around you to take you through, which is what the 5 colleges who are delivering the level 3 this year have had, not just from me but also from my colleague as well. Now, for those of you listening who are considering, well, have City and Guilds got a level 3 Key Stage 5 technical available for early years and childcare? Yes, we have. Okay, and I've given you details on the left-hand side of my colleague Susie Gray, and her contact details, and Susie will give you more information about that. And again, that qualification went live last September and is being delivered already by colleges in England. And the same would apply, that if you are interested in that qualification as well, and we have several colleges delivering both and looking to deliver both in September, then obviously we would come out and visit your teams, your early years teams, to talk through the requirements of that qualification too. But the assessment principles for the early years qualification remain the same as I've outlined today in terms of the end tests and the synoptic assessments. Okay, so we have one final poll question for you coming up, and then we're going to start wrapping up and give you a chance to ask any additional questions.
Thank you, Paul. Final poll question is, how many of your students go directly into health or care? Fantastic. And we'll share results.
So again, a mix, several, some, few. I think one of the things I want to reiterate with the design of these qualifications, both at level 2 and level 3, is that the employers were very keen to build qualifications that would have clear exit points. And I think this is one of the fantastic things about these technical qualifications. It gives students choices. In other words, at level 2, directly into work or onto an apprenticeship program, or on the level 3, again, directly into work, onto an apprenticeship program or into higher education. And I know some of you, some of the colleges listening in today, have work-based learning teams within your college environment. Some of you work very closely with those, I know that, and it's very much linking in with those teams and you know, obviously allowing those students to have that informed decision about, look, you know, is an apprenticeship the best way for me? Is work, directly into work, the best way for me, or is to go into higher education and further professional training the route that I want to take? And these qualifications have been built to enable that to happen. So without further ado, we have now time for questions. All right, so hopefully that will give you a flavour, an overview of what the 2 qualifications are, look like, feel like, both in terms of content and assessment. But as I said, please we will be able to come out and see you and talk to the teams in much more depth. And hopefully this has given you a flavour of these two new exciting opportunities for your learners.
Okay, thank you, Paul. First question that's come through is, do these technicals map into the new apprenticeship standards?
So, good question. Not directly is the immediate answer. What I would say, however, is that the Level 3 Key Stage 5 first year qualification, so the 540, has embedded the care certificate knowledge. All right, so that's the first thing to say. And secondly, if you are setting up placements for your students in a health or care environment, then it is, whilst it's not a requirement of the qual, it could well be that you work with your employers to say, look, we're delivering the knowledge within the care certificate, which is part of the apprenticeship standards. As you all know, it's a mandatory requirement now of the new standards, and it may well be that in discussion with your employers, they would assess their students and award them with a care certificate itself, but that is not a requirement of the qualification in its own right, but it would equip them when if they progress to apprenticeships to go forward, and the knowledge is there for that. So no, directly it hasn't, but you'll see a lot of crossover to see the similarities between the technicals and the new apprenticeships.
Okay, next question is there a planned release of a scheme of work guiding through the units for the Level 2 and Level 3 Year 2, as there is for the Level 3 Year 1 course?
Right, that's a really good question. The answer to that is yes. When you look at the qualification handbook and the units are your schemes of work. So if you take any unit, you'll see that the unit covers a range of topics. Now, what City and Guilds has done is, and will be doing for the Level 2, is providing you with an exemplar curriculum plan. All right, so for each year we have a curriculum plan. We already have that available for the Level 3 because colleges have been delivering that since last September. And the intention being is that we will be writing resource materials to support each unit for the Level 2 and the Level 3. Now, we already have that through our Smart Screen resource for the Level 3 Technical for Year 1 and Year 2, and they are looking to develop that for the Level 2. So there's a lot of support around you, and again, as I said, when we come out to see you, we'll give you demonstrations of what those materials look like, feel like, but they do include PowerPoint presentations, they do include handouts, activity sheets, things that you can really use as part of your teaching and learning with your students as you take them through the curricula.
Okay, fantastic. And Paul, could you please just clarify what Smart Screen is?
Ah, yes, good question. Yeah, apologies, folks. Smart Screen is our online library, for want of a better word. It's a resource bank which we have available on a qualification by qualification basis, and all the units that are available in qualifications for the Level 3, for example, we have resources per unit. So, for example, anybody picking up a safeguarding unit at Level 3, we will provide you, and we've got available PowerPoint presentations, as I said earlier, worksheets, fact sheets, handouts, etc., that you can use with your students. Now, you can add to those, okay? They come in PDF and Word format, so that basically means you can add things to the PowerPoints, you can put your logos, college logo on, whatever you want to do with them, but they are supporting you in the teaching and learning for each unit, and colleges are using those now, and they are built in line with the units and the topics that you are expected to cover as part of your teaching and learning.
Okay, next question. Do you have any other types of guides to help support with delivery?
Okay, in terms of supporting you with delivery, you have the National Technical Advisors. So myself and another colleague will support you through that. That starts with an onboarding meeting. So basically, as I mentioned earlier, we would need to come out and see you over the next couple of months, and we can fix a mutually convenient date, and we would take you through the support that we have available, both in terms of teaching and learning resources, but also how we support you directly face-to-face by the network meetings that we come to within the colleges. So there is a lot of support around you to do that. So there's online resources, and there's also us in person. We also have marking and moderation guides, which are available on our website. We also have the employer involvement guides, which are available on our website, and we also have guides on teaching, learning and assessment. And when we come to see you, we will have copies of that for you. But I will say now, I think we can send you out the links to those that you can have this. So when the PowerPoint comes out, we will include links to those 3 documents which are available on a website. So they will give that overview as well. So I think what we're saying here is there is a huge amount of support around you when you start delivering these qualifications. And the other thing to say is once you do start delivering, then obviously myself and colleagues are available at the end of the phone in the event you have any questions, queries or clarifications that you need. So rest assured those colleges that are delivering it now, and one of the things I do with my colleges is that if you are looking to come on board, we will give you the contact details of the colleges that are delivering the level 3 this year, so you can contact them directly to get a feel exactly of how it's going, what they're doing, how they find the qualifications, how their students have benefited from these qualifications, so you directly get it back from those people who are delivering it so far.
Okay, we have 2 more questions and a few minutes left of the webinar. So first question, in placement, do learners on the level 3 have to be assessed in work-based practice like the early years learners?
Right, the immediate answer to that is no. No, they don't. So I know where you're coming from. In early years, as it's a license to practice, there has to be assessment of practice by an occupationally competent assessor in terms of those skills. No, in the health and care level 3 technical, it is not the same. Okay, it is not the same. But what we do expect is obviously if you're working with your students and setting up placements managed by you as training providers, we do expect you to monitor the attendance, monitor the achievement, and monitor what's going on with your students in practice. And many colleges, as you're probably aware, you may be one of them, have what they call work placement coordinators, work placement managers, work placement officers who really undertake the monitoring of how well these students are doing on placements. Okay, because they will have to achieve those minimum hours as we stipulated at level 2 and level 3.
Okay, final question is, will there be any textbooks for level 2 and level 3 available for learners to be purchased? Right.
The answer to that is no, there won't be. I'm sure you're probably aware that the digital revolution is hitting us, or has hit us, and obviously we're being encouraged to develop more digital online resources, and that's why we have Smart Screen. And Smart Screen, one of the things I didn't mention, Smart Screen also carries schemes of work, lesson plans for you tutors to look at, exemplar lesson plans, and in terms of materials on Smart Screen on a unit-by-unit basis, Smart Screen materials can be accessed by your learners, okay, remotely via their technical devices, their iPhones or their iPads or whatever, and so they have a login to all those resources, as do you. The only thing the students don't see are the schemes of work and the lesson plans. So no, we will not be developing textbooks. Okay, that rounds up the webinar. Hopefully you found that informative. It has been a bit of a whistle-stop tour, but it will give you a feel and a flavour of these 2 new exciting opportunities for you. I think what you need to do after today is contact myself, and you'll see up on the screen my email address. Okay, and I'm more than happy, and my colleague more than happy to put a date in the diary to come and see you. As I mentioned earlier, if you are interested in the level 3, okay, the level 3 early years educator technical, then my colleague Susie Gray will take that forward with you. But in the first instance, if you drop me an email, okay, and we're more than happy to put a date in the diary, we'll come out and talk to you in much more detail in relation to these qualifications. Okay, thank you very much for the webinar. Okay, further support to follow, but let's hear from you now, and this will be sent to you over the next 24 hours, 48 hours, and to include the links to the documents that I mentioned earlier, and you can also have a recording of this webinar as well. So, thank you very much. Have a lovely afternoon. Take care and goodbye.